Hello, good morning, good afternoon, good evening, wherever you're watching me from. Happy weekend to you and to your family. You are highly welcome to Elder Living with Deborah. You're welcome to Elder Living with Deborah. Thank you so much for coming around. I wish you and your family a happy weekend. Happy weekend to you and your family. So, yeah, I can see you. I can see you, my beautiful guest. I can see you. Thank you so much for coming around. So, of recent, we'll be talking about fertility, infertility, causes of male fertility, causes of female infertility issues. And today we want to still talk about female infertility issues. It is actually a very, very broad topic. But today we are going to be doing justice to it as much as possible. And if we cannot finish it today, we'll continue next time. So thank you so much once again for coming around. Every day matters. Thank you so much for coming around. Happy weekend to you and happy weekend to your family. So we have our guests already in the building, and so we'll be starting without any further ado. Okay. Thank you for coming around. Please let's share from our end. Let's share the stream from our end. And I've already shared the stream from my hand. So I'm going to be introducing our guest right away because I don't want to be taking so much of a time. I don't want to be taking so much of a time. So I'll be introducing my guest right away. So she is by name Mrs. Yeah, she is actually a Mrs. She is Mrs. Sarah Mante Alabi. She is Mrs. Sarah Mante Alabi. She is a child of God. Wow, I like that word. She's a child of God. She's happily married. Hey, you want to hear that again? Happily married to Mr. Paul Alabi. Okay. And they are blessed with a lovely son that shares their world. Hey, can you imagine? Okay. They are blessed with a lovely son. Let me just quickly mute my guest for now. Okay, they are blessed with a lovely son. They are shares their word, and she had a first degree in animal production and health from a prestigious university. Okay. From my alma mater. Okay, so she bagged her first degree in animal production and health, and a second degree in agricultural science from the Hebrew University of Jerusalem. Okay, so today we are going all the way to Jerusalem today. A second degree from Hebrew University of Jerusalem, where she actually majored in human endocrinology. So it's quite interesting to have her in the building today. She says she's a refined blend of an extrovert and introvert. Okay, and actually that's true because I know her so well. You could see her just keeping quiet today. You could see her talking tomorrow. You could see her in between the following days. So that's actually true. And she simply finds her seat on the balance of both. Okay. She's a firm believer in being she is a firm believer in being an homemaker, a strong advocate for international living and balanced lifestyle. Okay. She loves to read, she loves to cook, she loves to sing, she loves to watch movies, and she loves to go on adventures. And our core ministry is reaching out to young people, helping them define purpose, as well as empowering girls and ladies. Okay, so I actually gave her a nickname of recent, but I won't be going into that today. I gave her a nickname of recent. This wedding, you must watch it. So I actually gave her a nickname of recent. I'm going to save that for another day. When I get that video too and I go viral, when I get that video too and I go viral, I will share more with you. You may not really understand now. Okay. So I have the pleasure to introduce to you Mrs. Sarah Mante Alabi. Thank you so much for honoring the invitation. It's
Uh,
nice having you around. Thank you. Thank you. How are you
it's a
today?
pleasure being with you. Yeah,
Thank
I'm
you.
good. I'm fine.
Okay.
Bubbling as usual. And it's a
Happy
pleasure to be on
weekend.
your channel this morning
Wow,
and to
wow,
see you
wow.
all. I'm so happy to be here and so happy to be on this platform with you, sharing interesting topics that would be blessings to people and bring
Wow.
about awareness. And
Yeah,
I
yeah.
really feel honored to be on this platform. I really want to say thank you
Wow.
very much for considering me to be with you on this platform. Thank you very much.
Thank you too. Thank you so much for your time. Thank you for everything.
Yeah,
Thank you so much. Thank you so much. Okay, so others will be joining us. Thank you for coming in. Early years matters and everyday matters. Thank you so much for coming in. So we are going to be talking about the common causes of infertility. We are streamlining to females, like I said, and we'll be going to be considering the possible alternatives. Okay. So let me start by saying that infertility is not something that has to do with females alone. A lot of people, oh, when these couples don't have a baby after 1, 2, 3 years, they start looking at the woman. They're saying, when are you going to give us a child? When are you going to give us?
exactly.
Oh, we have someone in the building, Lawal Peculiar. Thank you for coming around, my chief matron. Thank you for coming around. My chief matron is in the building. Happy
Yeah,
weekend to you and to your family. So a lot of people think that, oh, infertility has to do with only females, only female, but on the contrary, it has to do with the two couples, okay? And infertility is absence of conception after 1 year. Some people will even say if you are 35 and above for the females, then it is absence of conception after 6 months. So let's just take it to 1 year. Absence of conception after 1 year of regular intercourse without any contraceptive. You are having regular intercourse and still no pregnancy is forthcoming. So that is infertility. So let me hand over to my guest. So what are those common causes of infertility? What are those possible alternatives you will like to share with us? As you carry on, I'll be stopping you to introduce people as they come in,
no
okay? And
problem.
be
No problem. No
contributing.
problem.
I'll also be contributing in one way or the other. So over to you. Thank you so much for coming.
Yeah, so I would like to start by giving this disclaimer alert that I am not a doctor, I'm not a medical doctor, I am not a gynecologist. I am just a scientist, and I'll be speaking from the perspective of a scientist because majority of of whatever diagnosis the doctors will be giving to you or the gynae will be telling you will be based on research, will be based on the experiments that they have carried out, and whatever experiments they carry out and what the experiment says is what they will base their diagnosis on. So I would say that the word infertility is a very delicate word, and on this session I would like to say that we are in no means trying to sell out fear to anyone,
Of
but
course.
for knowledge sake and for better preparation for the future, to help you prevent infertility at all costs. I am a believer, and I would say that I hinge my faith on the Bible. Exodus chapter 23, verse 26 says, there shall none cast their young, nor be barren in the land. And that is what I stand on. And so, on the basis of that, I would just like to tell us that infertility is just a phase and it will come and go. According to WHO, they defined infertility like Deborah said, that it's the inability of a married couple to conceive after 1 year of active sex in marriage. So if you are like 2 months after wedding, 3 months, and you're already having fears, I'd like you to bring down the fears down, bring the fears down,
Attention.
because it's after 1 year. Yes, bring down the tension, because oftentimes, like she said, it's always the woman that they are like, oh, she's the witch, what's happening, you're not producing, you're not this and that. And quite as we go along, we'll see some of even the causes of infertility. Some of them are very serious, while some of them are so trivial that you just look at it and you don't even feel like it should be a cause. So we can also define infertility to as the inability to conceive or to carry a child to term. It's not just the inability to conceive, but inability to carry a child to term. And if infertility is the inability to conceive or carry a child to term, then there should be a cause. There should be a cause. There should be reasons why there is the prevalence of infertility. And I would say that the prevalence of infertility, the causes of infertility, can be grouped into three. And I would say that number one, we have the general factor infertility. We also have the male factor infertility. We have the female factor infertility. And these are, they are in their own world. They can be responsible for for the case of infertility. Under the general infertility, the possible options are immunological reactions, malnutrition, sexually transmitted diseases like HIV, syphilis, gonorrhea, hepatitis. Age factors can also be there. You have drug abuse, alcoholism, genetic defects. Like in the case of men, although we'll not be talking about men, but just like a kind of like a side issue, like abnormality in the sperm morphology can also cause infertility for men as well. Stress, depression, anxiety, all these things, they are generally they can cause infertility. But for the sake of this our discussion, we're dwelling more on causes of female infertility. I don't know if you have anything to say, Deborah, before I list out some of the factors for female infertility that I have been
Yes,
able
yes.
to gather. You said?
Thank you so much for coming in. Aishat Omolola, thank you for coming in. Happy weekend to you and to your family.
Yeah.
So you can continue. You can continue. Thank you.
Okay, so for female factor infertility, I've been, amongst so many other factors, I've been able to kind of like highlight some of the factors of female infertility. You can, it can range from nutrition and diet, it can range to hormonal imbalance, to cancer, fibroids, tumor, to abortion, to anatomical defects, to abnormal ovulation, to chemicals, drug abuse, like I said up before, then obstruction of the reproductive tract or the reproductive pathway. And I'll be giving a little more details on some of these factors I've highlighted down. So I would say first and foremost that as a lady or as a woman, you have been settled for life. In the sense that the moment you're born, the number or the total number of eggs you can have has already been given to you. Like you already have the total number of eggs that you can have in a lifetime. Although these eggs are already, they are kind of like, I would say they're in an arrested state. That means they are not developing almost immediately. They begin to develop when you get to the stage of puberty. And
Puberty.
that is why you must be very intentional, because excuse me, the eggs don't regenerate, they only decrease. The more you grow, the more they decrease. The more you grow, the more they decrease. And this pubertal stage is majorly under metabolic control. So as a result of this, undernutrition or overnutrition, if there's anyone like that, can have a great effect on growth on the growth and follicular development. Sorry, I'm having to on growth
Exactly.
and follicular development or ovulation. Do you understand? So it's very, very important to know that nutrition is how would I call it now? Nutrition is very, very important when it comes to you
Fertility.
as a woman and when fertility is concerned. What you ingest is very, very important. The kind of food that you take goes a long way in defining how your body thrives and how they come to this process of development, how they help in the developmental stage. We talk about sodas, junks, food that are not nutritious. One way or the other, they will increase your blood sugar level. Once they increase your blood sugar level, it can lead to diabetes and also obesity. And when obesity is involved, it can also lead to increased high blood pressure. You can have high blood pressure. And all these factors are also responsible for infertility. In a case where you have when you have high blood pressure, increased blood pressure, it can lead to miscarriage or even the death of the mother. That's why,
Exactly.
during pregnancy, your blood pressure is monitored like what have you, because it can lead to miscarriage, and it can even lead to the death of the mother. So what you ingest is very, very important as a woman. You don't just nib on anything. You don't just eat on anything. You don't just snack on anything. Be intentional about what you eat. Be
Exactly.
intentional about what you consume as a woman. I'll be talking about all these factors, and I'll be talking about ways to kind of like have a remedy, or how to improve on all these things. Talk about green leafy vegetables. You can never go wrong with it. Talk about kale, lettuce, cabbage. Even if you say you don't have all these oyibo leaves, your ugu, your green leaf is very, very important.
Hmm.
Very important. Very, very important. Like, one funny thing I observed, sorry to be personal, about my dad is that in a day doesn't go without him taking something green. And I look at how it affects his lifestyle. I see how it affects his health. It's very rewarding. Very, very rewarding. Another thing is green vegetables, like vegetable fruits. We talk about green peas, carrots, avocados, beans, lentils. All these things are very important. Then I would suggest that you prefer plant protein more to animal protein. When I talk about plant protein, I'm talking about beans, lentils, and even if you would take animal protein, consider white meat rather than red meat. You understand? Like fish, salmon. If you say salmon is too expensive, or you can't even have access to it. Titus fish is there. It's very rich in omega-3 fatty acids, and they are very, very good. They are very good. They help to kind of like renew the body system. Now, if you must eat, like I said, if you must even eat meat, go for white meat, fish, or even chicken. I pray that God will provide for you in Jesus' name. Another thing is that go for
Amen.
natural drinks rather than all these sodas. Like I
Okay.
said, natural drinks always, natural drinks, natural fruit drinks. One thing, I was initially addicted to soda, and like this soda drink, like I just walk, and once I'm coming out, coming from somewhere and it's hot, it's sunny, I just branch. There's one shop in front of our house before. I just branch there and I grab it. But all of a sudden, I began to ask myself, Sarah, do you have intentions of living long? That's number one. Do you have the intention of being fruitful? Because all these things, it's a personal determination. If you are not determined to be intentional about what you eat, then you can just live anyhow. And at the end of the day, oftentimes they don't even just come as just one time effect, bam, and you see it. It has a ripple effect, and the ripple effect is always in the future. By the time you want to enjoy your life, then they tell you, no, calm down. I've enjoyed it. It's our time to enjoy ourselves for you as well. So I pray that God will help us to be intentional about what we eat.
Okay.
Another
Thank you
thing
so
I'll
much.
be discussing. Okay.
Please, just a minute. Loretta Omosi, you're welcome.
Oh,
Yeah,
you're here.
Omosi,
That's
thank you.
my
And please,
girlfriend.
okay, I thought as much. I've not seen this face before.
Yeah,
I've not
she's
seen
my
this face
friend.
before. Thank you so much for coming around. Loretta Omosi, happy weekend to you and to your family. So, our guests have taken time to talk about eating. She mentioned something. She said, "Eat intentionally," and she said something like undernutrition and overnutrition. Yes, because when you have excessive weight gain, it will reduce your estrogen level. So when you are underweight, when you are overweight, these two things have a negative effect on the body when it comes to fertility. Love you guys. You are doing a great job. Thank you so much, Loretta. So undernutrition, overnutrition, they play a major role when it comes to fertility. And like she said, go for foods that are rich. Just try to do away with all these junks, all these sugary foods, because eventually they may result into insulin resistance, they may result into diabetes, high blood pressure can come knocking at the door. And these are also important issues when it comes to infertility: high blood pressure, diabetes, insulin
Mm.
resistance. When you've taken so much sugary foods, sugary drinks, pasta, semo, pounded yam, and rice, and you have so much sugar circulating in your
Yeah.
bloodstream, insulin is all even fed up, like, oh, I am tired of picking up all these sugars. Before you know, diabetes sets in, and then high blood pressure sets in, overweight sets in, and all these things are also major factor when it comes to fertility. So the very first point our guest has elaborated is your nutrition, your diet. Thank you so much. You can carry on.
Yeah, another one I'll be talking about is the effect of childhood environments on the length of reproductive lifespan. You know, it's quite unfortunate that we do not have the choice of where we are going to be born or the family we are going to be born into. But I would like to just make reference to kind of like a research I was privy to be enlightened on, or like I was able to be in the conference and they presented a research. And this research was carried out on children that were born in slums in India, and was compared to okay, they had like two sets of children that they carried out research on: those who were born in the slums in India, and those who were that they grew up in the slums in India, and those who were born in the slums in India but relocated to the US. Now, at the at the stage of puberty, they began to examine some of the hormonal levels and everything, and they discovered that these children, despite the fact that despite the fact that they relocated, you understand, to the US, they still had the similar challenges in their pubertal at their pubertal stage. They still had the similar challenges with the children that were born in the slums in India and they were still in the slums in India. This
Wow.
goes so well to tell us that a lot happens during that childhood stage. A lot happens during the childhood stage that you cannot just take your eyes off it. Now, I would use some terms, and I'll just to explain how these things happen. They show that, okay, once there is an energy deficit, that means because of malnutrition and all that, during that childhood stage, the energy deficits, there are low levels of leptin, and once there's a low level of leptin, there's a decrease in the expression of KIS1 enzymes. And once there's a reduction in this particular enzymes, it can lead to pubertal arrest or delay in puberty. You understand? And so once these things happen, the research, went further to show that if the onset of puberty is delayed, then it can lead to altered ovarian function, which can lead to an increase in oocyte loss and early menopause. So once there is a decrease in the level of oocytes that you have over time, you can get into early menopause because of this. And it's so saddening. Like I said, we don't have the privilege of choosing the family or the environment we are going to grow in. But as like I said before, be intentional. The onus now lies on you to, in as much as possible, choose the best place or the environment to which your children will be born and where they will be raised. Avoiding environments that are highly exposed to chemicals, to industrial exhaust, to germs
Exactly.
and the likes. Because at the end
Exactly.
of the day, these adults are already done even during that developmental stage before puberty and towards puberty. And you would never know, you can never see. It's just there doing its own havoc. And the best thing you can do for yourself as just a side business is to be mindful of your choice of a life partner and what you expose your children to. What you expose your children to. Yes, you may say, it's me, I'm matured, I'm fine. But what you expose yourself to and what you expose your children to goes a long way to determine their level of fertility at the end of the day.
Wow.
You must aim at settling down early as much as possible because, you know, like I always say something that if you are born in Africa, the odds are already against you one way or the other. I'm sorry to say, the odds are already against you, like psychologically, environmental wise, and everything. And somebody may say, we are still saying that we should choose the best place for our children, and I want to also I want to have the money before I settle down and all that. I pray that God is going to really, really settle you down. It was before I used to have that
Mm.
mentality of like, you stay long before you get married. My dear, there's no, there's no big, there's no, there's no glory in it. Let me just put it that way. If you have the privilege of settling down early, please do
Yes.
because as a lady, every every month the eggs are coming down. The follicular fold is coming down. And you just have to. Some people don't know this. They just believe that I'll be sweet, sick,
Yes.
16, and sexy till when God comes. It's not always like that. It's not always like that. So these are some of the factors that we don't put our minds to it, but also they have an effect on
Exactly.
fertility levels.
Exactly. Thank you so much for coming in. Glory, Damilola. It's nice having you around. So we have a physiologist in the building.
Wow.
Have a physiologist in the building. Thank you for coming around, Glory. How are you doing today? That's Glory Adebile. Thank you.
Wow.
For coming in, Glory.
Biochemistry, biochemistry,
Yes.
our
Oh,
biochemist.
biochemist. Oh, no,
Yeah,
when you go
yeah.
to school and you graduate, sometimes I forgot it. I thought she studied physiology.
Oh,
Okay, so we have a biochemist in the building. Okay, so like you said, environmental factors too, and that's age. Okay, biochemistry. Wow, see how time flies. My mind went to physiology. So we have a biochemist. For those who don't really understand what is happening, so we actually graduated
it's
from
a
the same
connection thing.
university. Okay, we are having a kind of reunion here already. Early years
Yeah.
matters. We need to start calling OAU people. Oh, not OAU, OOU people. Early years matters. You need to start calling OOU people to come around. We're having a loud tech conference already here. Okay, so we all graduated from the same university. Okay, so environmental matters, age. Some people don't think age, even if I'm 40, one day I'll get married. Let me just go ahead and get this done, get that done, get that done. And like you said, the eggs are declining. The eggs are declining as you are getting older. And another thing that has to say, I'm telling you, another thing that has to do with the environment is what a child is exposed to depends on the environment a child lives. Those that take alcohol, take cigarettes, they smoke, yes, there are females that do all those things, and it's saddening that you even see some females, they are pregnant and they still take alcohol.
Oh,
They still
who
smoke.
who
You
even smoke?
understand? So I think that is what the environment has done to them. So, like you said, the environment where you are, environment where you develop your child also matters. Age also matters. No time to check time. Like I always say, no time to check time. So if everything is in place, just go ahead and get married. Glory. I think your
Leave,
brother just
leave
got
my glory
married.
alone.
So don't wait till you have the millions or the millions of naira, okay? So age is counting, and the environment, alcohol, tobacco, cocaine, all these things also affect fertility. All these things. I love this, the feeling when you meet your cosmate. Exactly. I'm feeling like I'm in Ogbomosho right now. I'm feeling like I'm in Lautech right now. Okay, so over to you. Let's continue. We've talked about, you
Okay.
also made mention of pelvic inflammatory disease the other time, and that's actually another
Mhm.
paramount one. gonorrhea, transmitted diseases generally, sexually transmitted disease, STIs,
Definitely.
they are also another issue when it comes to
She's
fertility, speaking
fascinating.
of alcohol and all those things. And genetics too, you know, it's quite unfortunate that some people, their mother is fertile, the father is fertile, but they just discover that
Yeah.
they themselves are infertile. It could also
In
be
fact,
genetics too. Yes, some causes of infertility are not explained, they are unexplained, you know. So
yeah, those are
genetics factors,
idiopathic reasons. Like you can't, no known cause.
yes,
Like
unknown
just
cause.
idiopathic reasons, unknown cause, and some of
Mhm.
them are in our local language. Let me put it those ones. Attack from home. I pray that one will not be an operation in Jesus' name.
Amen,
Of course,
amen.
there are. We can't look away from all those things. There are. I just pray that we just God in His mercies will show forth Himself in our lives, and as many people that will be watching this that do not have any known cause, like you just look at it and there's no known cause, God is going to intervene for you in Jesus'
And
name.
do you actually know
And
that some people are actually the cause of their infertility? You know, do you actually know that? For example, when a woman, you know, when the ovary releases egg, the egg is going to, of course, it will be cut off by the fallopian tube. It will stay in the fallopian tube for like 12 to 24 hours before it
mm-hmm,
ruptures and, you know,
fertilization.
menstruation
Mm-hmm.
sets in. And the sperm can actually, a sperm that is quite motile can be there in the woman's, you know, system for like 5 days, waiting for the egg, while some can wait for up to 3 days. Now you see some women, the ovulation is forthcoming, and that is when like you said the other time, maybe it's an attack. That is when they will have quarrel with their husband. And instead of the
It's
sperm
an
to
attack. It's
be
an attack from home now. It's an attack.
instead of
God will
them to
not let them
copulate,
attack us
you
in
know,
Jesus'
instead
name.
of them to copulate and let the sperm go and be waiting for the egg, because the egg is not going to wait forever. It's just going to wait for like 20 to 24 hours. And God has so done it in a way that the sperm can wait. It can wait for like 3, 4, 5 days. So why don't we just check, oh, what, this is when I am ovulating. I think anyway, I think you are still going to come to ovulation disorders, because this is a primary issue when it comes to infertility. So if a woman is ovulating and she knows she's ovulating, then the next thing is for her to be able to calculate, when am I ovulating? Is it a 28 cycle? Is it a 30-day cycle? Okay, I'm ovulating on the 15th. Then anything from the 12, the man can start trying. From the 12, 13, you should start having
The
sleepless nights.
fact is that let us become real at this stage,
Yes, yes, yes.
Deborah. So many people just feel like, okay, I'm looking for a child. I'll just look for that particular date I'm ovulating, and then I'm just going
Wow.
to have sex.
And it
Excuse
doesn't work.
me, it's
It
not
doesn't work.
done. Like,
Yes,
let's spill it out. Sex is hard work.
yes,
Like, populating is hard work, and you must be intentional about it.
exactly,
Especially when
exactly.
you are looking to up to God for a child. Yes, I know it can be psychologically draining, but hard work from even from day 10 to day 14 to day 16. Keep doing it back to back. Excuse me, it doesn't kill as long as you're married. It is your own property. And you must be able to be active about it. Be active about it. Because some people just do it once and it did not happen. If God gives you the grace twice a day, please go ahead and do it. Because we are talking about you being fruitful. This is the promise of God. It's like He says you will be fruitful, you will multiply. And that is why I am here. That you will be fruitful and you will multiply and you replenish the earth. So being intentional about it, like you said, some people just one issue or the other. That's when anger will come in, that's when fights will come in. Put that aside. You know what you're looking for and go for it. Thank you, Deborah. If there's anything you want me to say, I don't know if I can continue.
Yes, if there's any other thing you want to say, I really want us. Oh, thank you for coming in, Mstel Beauty. Amstel Beauty, thank you. I'm seeing you for the very first time. Thank you so much for coming around. Happy weekend to you and to your family. Happy weekend. So I really want us to talk on ovulation disorders. Yes, because apart from the nutrition, the thyroid problem, the pelvic inflammatory disease, the genetics and lifestyle and all those things, this ovulation disorders is something that is so critical. So I would like us to
Okay.
also talk on like I said when it started, if we cannot finish it, we are going to continue next time. Okay, because myself too, I have quite one or two things to say. Yes, so if we cannot finish it today, we might continue next time. I want us
You
to
can
really
you can
talk on.
carry on if you're going to be talk on if you're going to talk on ovulation disorders, you can carry on.
Okay. Okay, okay. So thank you so much. Thank you for coming in, Mstel Beauty. She's saying thank you. I hope it's I think it's a female. Anything beauty now, we are the ones there. So thank you once again for coming in, Mstel Beauty. Yes, so another paramount factor apart from age, apart from your nutrition, which could, affect you, excessive weight gain, diabetes, high blood pressure, thyroid problem, environmental factors like lifestyle changes, lifestyle habits like taking alcohol, cocaine, cigarettes, and also changing partners, pelvic inflammatory disease. One thing is also very important, and that is ovulation disorders. Yes, ovulation disorders means when somebody, a woman, ovulates frequently or not at all, not at
At
all.
all.
Oh my God, when someone doesn't ovulate, how is the person going to menstruate? So ovulating frequently or not ovulating not at all, that is ovulation disorders, and this accounts for about 1 in every 4 infertile couples. If you see 4 infertile
Hmm.
couples and it has to do with the woman, 1 in every 4 is always associated with ovulation disorders. Now
Disorder.
this actually has to do with, there are certain hormones that are involved in reproduction. Yes, we have certain hormones. An example is
Mm-hmm.
estrogen, another one is luteinizing hormone, we have the follicle
LH,
stimulating
FSH,
hormone, we have the progesterone. Yes,
allotropism, and all
this
that.
hormone plays a vital role when it comes to fertility. Like for example, the luteinizing hormone is the one that will release the egg. Then the follicle
Yeah.
stimulating hormone will make sure that the egg gets matured right in the ovary. The egg is produced, the egg becomes mature before it is now released. So it is the luteinizing hormone that will stimulate the brain, and then the egg will be released, and then the estrogen, the progesterone will cause the maturation of the egg. Now if there is a problem with any of these hormones, it's going to be catastrophic. For example, every of these hormones now, they have a range. So in for every egg you want to produce, for every fertilization that want to take place, these hormones have a range, and if they are not properly secreted, if they are not properly released, maybe it is low or it is high, there is actually going to be a problem. There's actually going to be a problem.
Mm,
For example, now problem with the regulation of these hormones, reproductive hormones, by the hypothalamus. No, the hypothalamus is in the brain, or the pituitary gland of the
yeah.
brain, or
But
problems in the ovary. Problems in the ovary, maybe the ovary didn't release egg, maybe the ovary didn't produce egg, because without egg fertilization cannot take place. Okay. So the other time I said the sperm is going to swim inside, is going right to the fallopian tube to look for egg, because when the ovary releases the egg will be picked up in the fallopian tube, then the
pure
sperm will come to the fallopian tube and fertilize the
fertilization
egg.
in the ampulla region. Yeah.
Chiku Iyeye, you're welcome. Thank you so much for coming around. Happy weekend to you. Happy weekend to you.
I
I'm
think
seeing
we need
new
to ring the
faces
bell. This is the
today.
first mail we are sending today.
Yes, yes, we have a male in the building. Chiku Yeye. I'm sure Super Boss will call before we finish. Maybe he's at work. Super Boss will also call. Chiku Yeye, thank you so much. Happy weekend to you and to your family. Thank you for coming around. So we are talking, even though we are talking about female infertility, you could also learn one or two things. You could share this video with your friend, with your sister, with your colleague, with your anybody
Yeah.
shareable. Okay. So we are talking about ovulation disorders, and Happy weekend to you too. Thank you. So it is necessary that a woman knows if she is ovulating. That is where this whole thing starts from. Because these hormones, if they don't work properly, the woman is not going to ovulate. So how does a woman should know if she is ovulating? Now, what are the signs that a woman is ovulating? When a woman has regular periods, there are also instruments one could use to check if one is ovulating. We have the follicle monitor, we have progesterone blood test, we have home ovulation predictor test. Even thermometer can be used to check the body's basal temperature if a woman is actually ovulating. So like I was saying, if there is any problem with any of these hormones you are presenting about menstrual cycle, if there is any problem with any of these hormones, it's going to be catastrophic. That is ovulation disorders. And there's something also called PCOS. Yes, we are talking about
Yes,
female
polycystic ovarian
reproductive
syndrome.
infertility import. Oh, we have someone in the building. Hi, Debbie, this job lady. Oh, I'm not going to tell you
This
people who this
young man.
person is. I'm not saying that when you have a Mr. and a Mrs. in the building, it's always wonderful.
Uh-huh.
I hope I
Ah.
have not introduced the
Hi,
person. I hope
hi
I
to
have not
you.
introduced the person. When you have a Mr. and a Mrs. in the building, that's wonderful. Thank you so much for
Uh,
coming in, Mr. Paul Oluwaseun Alabi. Thank you for releasing your beautiful wife to come and share this occasion. Thank you so much. I'm enjoying this. It's really enjoyable. Thank you so much. So, like I was saying, PCOS, to introduce the person. Oh, early expert that I'm not going to live here today. Okay, this person on screen is the husband of this beautiful lady on screen. This person on screen is the husband of this beautiful lady on
Video.
screen. Okay, so you're highly welcome, Mr. Paul. You're welcome. So PCOS is a chronic infection, is a chronic condition that is characterized by hormone imbalance. Yes, when there is hormonal imbalance, that is a big, big
Um,
problem. If the luteinizing hormone is small, it's a pleasure. Really enjoying the light thing you are bringing up here. Thank you so much. If the luteinizing hormone that is released is not sufficient, if the progesterone released is not sufficient, how is the egg going to be released? How is the egg going to mature? And that is why infertility is not something you just keep to yourself. You say, I'm praying, we are praying. Yes, you need to pray, but you need to reach out to your doctor. How do you know
act, yes,
if your
act on it.
progesterone that is released is not sufficient? How do you know? Without going for a
The
test,
funny
by
thing is
saying you are praying, you are
that,
praying. So
the,
yeah,
the funny
can
thing
you
is,
go on? You want to say
in
something?
spite of the fact that, yes, even if conception happens, you understand, once there's hormonal imbalance, one way or the other, the fetus is not even going to be able to stay. Because now, take for instance, now progesterone is the hormone produced by couples sperm, and is responsible for uterine development, implantation, and maturity of the fetus till the umbilical cord of the
Yes.
placenta is developed and can take over. Now, even if conception happens, there's fertilization, and there's a problem with the hormones, and there's no progesterone, it will still lead to miscarriage.
Can
So
you see?
all these things are things that you need to go and check your hormonal levels. Do like an hormonal assay. Go to the clinic, do an hormonal assay. Let them check. Okay, are your levels okay? Because they can check these things, and once they see it, they know the kind of drugs to prescribe to you, and everything becomes okay and fine. And then, boom, everything works successfully for you.
Exactly.
So, like you said,
Exactly.
hormonal imbalance is one of the major causes of infertility. Is really one of the major causes of infertility. You can write on,
Okay.
Deborah.
Thank you so much. So there's something also called endometriosis. Endometriosis is where the tissue that are lining the womb starts to grow in other places. So for example, maybe they
Mhm.
start to grow in the ovaries, they start to grow in the fallopian tube. So It is actually the abnormal growth of tissues, of abnormal cell growth outside the uterus. So endometriosis is another major thing when it comes to infertility. These tissue cells can just start growing abnormally,
Growing.
outside the uterus. And another thing I would like to also talk is now live on YouTube. Okay. Another thing I would like to also talk of is failure of the egg to mature properly. And we've said that when those hormones, when anything tampers with the hormones, when the hormones get tampered with, then it could result to failure of the egg to mature properly. Another thing is problems with menstrual cycle. If the menstrual cycle is not consistent, you menstruate this month, you don't menstruate the following month, maybe the
The funny thing
ovaries,
is, some people will say, thank God, oh, Kowani Monsi. And I'm like, yes, thank God, Kowani Monsi. See this, man. Do you know the implication of what you are saying?
you
Do you know the
see.
implication of what you are saying? I'm like, some people just feel like, okay, okay, 1 month. I'm like, this is that okay? Like, do you know what you are saying?
They don't really know. Some people don't really know that is, as a woman, it is necessary, it is mandatory that you menstruate every month. As far as you've not gotten to menopause, it is necessary that you menstruate every month, because this could result, maybe one of the hormones is affected. And another thing I
Mm-hmm.
wanted to really talk about is implantation failure. After the sperm fertilizes the egg, the fertilization takes place in the fallopian tube. Then the zygote has to come down and develop in the uterus. It has to implant in
Uterus.
the uterus, bind to the lining of the uterus, and then the baby starts developing. Now, if the fertilization takes place in the fallopian tube and the zygote doesn't come down to the uterus, that is
Down
another
to the
problem,
uterus.
because the
Big
baby cannot
one.
develop in the fallopian tube.
Hmm.
It's a tube. It's a tube. It is too small for the baby to grow. It is just a passage. So if the baby starts
Mm-hmm.
growing in the fallopian tube, there's something called ectopic pregnancy. The
To
baby is meant
pregnancy.
the baby is
To
meant to
develop
develop
in
in the uterus. So
uterus.
the baby doesn't develop in the uterus, maybe it starts developing in the fallopian tube, it starts developing outside of the uterus. That is ectopic pregnancy, and such we have to be evacuated too. So a lot of things really come into place when it comes to fertility, when it comes to infertility, implementation problem. If the egg doesn't implant in the uterus, maybe it's implanted in the fallopian tube, and the baby starts developing in the fallopian tube, that is really a very, very great problem. And another thing is
Yeah.
uterine part. Okay, do you have any other thing to say before I continue?
Yeah, another thing I also want to add to what you have just said is obstruction in the reproductive tract. Sometimes you get to have obstruction in the reproductive tract, one reason or the other, something is happening there. I can remember one of my aunties also had that issue, and for a long time she was with her husband and nothing was happening until like my mom was like, take this woman to the hospital. She's not barren. She has had a child before.
Mm.
Take her to the hospital. Something must be wrong. And at the end of the day, they did a flushing for her, and then she had a child. So
Yes.
oftentimes, some of these things you understand can also cause infertility when there's an obstruction. In as much as there's an obstruction, the sperm cell cannot swim up,
Mm-hmm.
fertilization cannot occur, and so you cannot have the development of a fetus of this thing. So obstruction of reproductive tract so can also be a possible cause of infertility, and it has a solution. They can flush it when
Okay.
you go to the hospital.
Okay. So people shouldn't just keep things to themselves and say we are praying, we are praying. Reach out to your doctor. Even uterine pathologies like fibroid, you know, fibroid.
Mm-hmm. Mm-hmm.
And there's
Hmm.
something so bad about fibroid. Someone may even have fibroid and the person will not know. Someone may
Hmm.
have fibroid and the person will not know. So it
Hmm.
is when you now reach out to your doctor and they carry out this examination, they start telling you, we are seeing something that look like a mass. And then they will say it is fibroid. So for example, fibroid now, it may be blocking the fallopian tube. And if it is blocking the
So
fallopian tube, how will the sperm swim and get to the egg? Because the egg is in the fallopian tube. How is the sperm going to swim and get to the egg? So another thing is uterine pathologies like fibroid and damage or blockage of the fallopian tube, like our guest said, blockage of the fallopian tube. Maybe there's a partial blockage, there's a complete blockage as a result of infection or as a result of ectopic. Okay, someone is saying I have a question. How do you know that there's obstruction in the reproductive tract? That is why these things are things that are discovered when you go for examination. You understand? Stel.
Examination.
Yes, these things are things that are discovered when you go for examination. That is when you can see that, oh, there is something obstructing the reproductive tract. Maybe it is fibroid, maybe it is ectopic pregnancy, maybe it is an infection that has resulted. So a woman that has not, tried and tried and tried to conceive after 1 year, please go to the hospital and get tested. In fact, there was a time I went to the hospital, something happened. I was telling the doctor, I just wanted to check me. He was telling me, do you ovulate? Let us check if you ovulate. I say, I am ovulating. He said, no. You know the way our doctors are in Nigeria. And let me refer you to one
Mm-hmm.
hospital. Let us check first if you're ovulating, this and that. I say, no, I am ovulating. I know I'm ovulating. I just wanted to check one or two things. So it's good to always go to the hospital from time to time. Don't say, I'm not sick, I'm not sick. Oh, you're not sick, but once in a while you need to go for that checkup just to
Mm-hmm.
keep your body healthy. So if the
And
fallopian
the
tube
thing is,
is, okay.
continue. Sorry to cut you
Okay.
in.
No, someone is saying, can a woman with closed cervix menstruate? Can a woman with closed cervix menstruate? Okay, if a woman,
Wow.
okay, will you answer first, or I answer?
Oh, I would, if I would say yes, and at the same time, I might be able to say no.
Mhm,
Why would I say yes? Is the fact that in as much as the egg is released, ovulation takes place, the egg is released.
mhm,
Is it total closed of the cervix? The cervix is just like a pathway. You understand? It's like a road. So it may not be a total closage. She might still menstruate.
mhm.
So if it's a total closage, then there's going to be a problem. She may not see it. She may not see her menstrual flow or something. You understand what I'm trying to say?
Yes, yes. Thank you. Thank you for that brilliant answer. So once a woman has ovary, the ovary is functioning well, it releases egg, the egg doesn't spill a sperm, it ruptures after 1 day, the woman menstruates. Now, the issue is, where is the blood coming out from? Just like she said,
Mm-hmm.
if the cervix is the passage, that is the entrance. No, the entrance from a woman's body to the environment is the cervix. So the blood is coming out through the cervix. If the cervix is partially blocked, like she said, the blood can still find its way to come out. Even if it take 10 days or 8 days, it can still find its way to come out. But if the cervix is totally blocked, then the question is, where is the blood going to come out from?
Going to.
Understand? So, like she said, the answer is yes, and the answer is no. The answer is yes and no. So if we keep on dwelling and dwelling on the causes, we are going to stay here for the whole day. Our time is almost up. We have not even talked about the treatment. So should we take that another day, or should we continue? I will leave my guest to answer that question, because I know I didn't tell her that she's going to be staying longer than this. So should we fix another day to continue, or you want us to finish everything today?
I think we should schedule another day because I have some other engagements for today, and I have a baby and he's already awake now, just managing the situation here. So yeah, I think another weekend will
Yes.
be good.
Yes, exactly. Another weekend will be good. So Loretta said, I was super stressed 1 month like that. I didn't see it. You guys should have seen me panicking until I was told stress can cause that.
Yes,
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 yes.
yes, 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 exactly.
Stress, depression,
Yes,
anxiety, those
yes,
things
yes,
can affect your
exactly.
menstrual flow. Stress,
Yeah,
depression,
yeah,
anxiety, they are major causes. Even sickness. When
yes,
you are
yes,
sick, it can affect your menstrual flow. So
yes,
those things are the thing is oftentimes we as ladies we are not aware of ourselves. Like you are not aware of what's happening in your body.
your body.
If you take time to study your body, you should be able to know that okay, this could be the likely cause of this could be the likely cause of this. But because you're just oblivious, you carry your body and the body follows you, you feel like you're fine. You must be able to study your body, know what's happening around your body. I could remember there was a point in time I noticed that whenever I'm about to have my period, all of a sudden my stomach would just get swollen, very swollen, like as if I'm pregnant. I'm like, what's happening? I'm not married yet. Lord of Jesus, what is happening? And I looked at it for the first month, it happened, second, third. The next month I carried myself to the hospital. Excuse me, sir,
Exactly.
I need to do a check.
Mm-hmm.
You don't just sit down and feel like, oh my, it will go. Let me not speak Yoruba. I think some people here are saying I don't understand Yoruba. Like, it will go. There's no, yes. See, I pray a lot. If you know, I pray. But at the same time, I don't take things for granted.
Mm-hmm.
I don't
Mm-hmm.
take things for granted because I know, yes, when you pray, the Bible says faith without works is dead. You must
Yeah,
pray, have faith, and then do something about it. You understand?
exactly.
I had to go to the hospital. From there, I was referred to a gynecologist. I went to meet the gynecologist. They did a scan on me. They did everything. And the woman said, your eggs are looking very good. There's nothing wrong with you. Hey, at that time, I said, okay, so my body is just playing around me and trying to feel itself. No, while at the end of the day, I came back to normal. I was enjoying myself, and I became. So apparently, maybe I was reacting to the weather or something at that time because the weather was changing from summer to from winter to summer and all that. So maybe my body was just changing to the environment. It could be, but just feel like there's nothing happening and you just sleep over it can be very dangerous at times. You don't know. The funny thing is that you don't know what's happening on your inside.
Mm-hmm.
So once you see any signal that calls for attention, be ready to give it the necessary attention that it demands.
Thank you. Thank you. Tina Charles, thank you for coming in, but we are rounding up already. We are rounding up already, Tina Charles. It's 1 to 2 p.m. every Saturday. Oh, Jenny's Air Salon. Thank you. We are rounding up already. Good morning, everyone. Thank you, Jenny's
Good
Hair Salon.
morning.
Thank
Good
you,
morning.
Tina Charles. I'm so sorry we are rounding up already. So, when a woman starts having irregular cycles, hey, you've got to start checking on your doctor. When you see some women, they have excess hair in their body, and people will be like, "Hey, don't go near her. She's a man. She's a man." Excess hair too. Yes,
The
it's one of
hormones
the
that Mhm.
it's one of the signs of PCOS when the testosterone is is getting so much. You see a woman developing excess hair. Okay, so we would like to stop here for today, okay, so that we can attend to other things. And yeah, mine got sorry. Let me quickly take this comment. Mine got swollen at times. I will just add weight anyhow, but after the menstruation, my body gets back to normal. Okay, so we've taken time to discuss the causes. So I'm going to fix another time with our guest. She's going to help us to check her schedule. We'll talk about the signs. What are the signs and what are those alternatives? What are those alternatives? This session was so informative. Thanks for sharing your wealth of knowledge with us. God bless you. Thank you for coming around.
Amen.
God bless you. Please don't
Thank
forget to
you.
thumbs
Thank you.
up, leave your comments behind. If you are coming for the first time, please kindly press that subscribe button before you take your leave, and also turn on that notification bell so that you could get notified anytime I upload. Share with your friends, share with your colleagues, share with your somebody will say share it in your church group, share it in your mosque group,
Anywhere shareable.
Anywhere shareable. Mariam Adepoju will say, share it anywhere shareable and let us loud the awareness. So next week I'll be having a program. I don't think I'll be going live. August is always a very, very busy month for me. Okay. But I'll let you know anytime I'll be coming live again in August. August is a very, very busy month. Okay. So if I don't go live next week, maybe I'll just premiere or we just meet again in
Mm-hmm.
3 weeks time, because it's like in 2 weeks time I have a program too. Princess Minate, thank you for coming around. It's nice having you around. I'm ending this stream already. Thank you, everyone. Thank you for coming, Mrs. Seramante Halabi. Thank
Yeah,
you so much
it's
for
a
coming
pleasure.
around.
It's a
Thank you.
pleasure to be here.
Thank
I
you.
really appreciate every one of us. And
Yeah.
just this like a closing remark or a closing statement. I always tell people. Some people say I don't smoke, I don't drink, I don't take alcohol, I don't do drugs, I don't abuse drugs. But the question is, every drug is a potential poison. Some people they are so quick to taking drugs, like any small thing like this they'll just gather everything, five, six, seven, and they drink it. Every drug is a potential poison. Make sure you exhaust your natural options, your natural remedies before you now consider drugs. Another thing is know what works for you. When it comes to drug, oh, my sister used this, it works for her. My brother did this, it worked for him. And you feel like you can also take the drugs and it will work for you. No, know what works for you, know what works for your body system. It's a pleasure being here, and I really want to appreciate you, Deborah, for welcoming me to your channel, and we hope to meet some other time to conclude this discussion. It's a pleasure. To all of our viewers, thank you very much for coming
Yeah.
around. We
Yeah.
really appreciate your presence and your questions and your comments. God bless you
Thank
abundantly. Thank
you.
you very much.
Thank you so much. Thank you. Thank you.
Thank
Oh,
you. Bye
thank you. Everyday
bye.
matters. Thank you. Princess Minate, thank you.
Thank,
Glory Damilola, Paul Alabi, Oluwaseo,
thank
Mtel
you.
T, NSS Saloon, Tina Charles, Elias Matters, Loretta Omosi. Hey, so much people. Chiku Yeye. Everyday matters. Thank you, everyone. Aishat Omolola, thank you everyone, whether I mentioned your name, I didn't mention Shady Princess and Beneficial and Cooking them all. Thank you everyone for coming around. See you during the week. I upload every week. I go
Bye.
live every Saturday. Okay, so see you during the week. Thank you for coming around. I wish you a happy weekend.
Bye.
Ciao, ciao.
Bye.
Ciao. Thank you. Thank you so much. Thank you. God bless. Thank you.